Hey everyone, thanks for joining us tonight, whether you're here with us now or watching it in the future. We're happy that you're here. I'm Alex Barker. I'm the founder of the Happy PharmD, where we are helping pharmacists create inspiring careers and lives. Tonight, it's all about medical writing and probably a lot of other medical writing topics as well. With us tonight is Milena Murray. I've known her for a while now through a few connections. She worked with us in our company, and she's going to be sharing more of her story, getting into medical writing. And our host is my good friend, Chris Bakley, not John, but Chris. Call him Chris. That's what friends call him. It's a running gag for these webinars that we do. He constantly has his name as John because that's his real name. Anyways, we're excited for you guys to jump in. I'm going to be answering questions in the chat, and I'll hop back on at the end, where we'll talk a little bit more about taking those first steps into medical writing. And I think, Chris, I'll let you jump into it.
Yeah, perfect.
I saw a question already.
I was going to say, yes, it will be recorded, right?
Yes, we're recording it right now. If you didn't hear the odd computerized voice that said, recording will start now. So with that, I will help out with support.
That's a great question. I wonder if we can change that voice as well. Probably not. Okay. Well, welcome, Milena. Thank you so much for being on with us today. Before we go into all the detailed about medical writing, can you share a little bit about yourself, where you're from, a little bit about your background, and then we'll get right into everything.
Yeah, sure. So hi there and hello to everybody out in Zoom land. My name is Milena Murray. I'm currently located outside of Chicago, Illinois. I went to school in Philadelphia at the Philadelphia College of Pharmacy, and then spent a year in Brooklyn doing my PGY1, and then moved out to the Midwest to do an infectious disease fellowship. I also did a master's in clinical investigation at Northwestern during my fellowship. And then I was lucky enough to stay on as faculty at Midwestern University, College of Pharmacy, the Downers Grove campus. And my clinical practice site is downtown at Northwestern, and I specialize in infectious diseases. And I'll leave the rest of the fun for some questions I'm sure I'll get along the way.
Yeah. So I guess, obviously today it's a big focus on medical writing. I'd like to kind of if you can think back in time. I know Alex already spoke of time travel in terms of this will be in the future for people who want to watch this recording later. So going back, if you could put yourself back in your shoes at when you were doing or I guess let's back up. What was your role before medical writing, before you made that decision?
So I currently do this medical writing as more of a side hustle. So just to put that out there, I love my quote unquote day job. And I do a lot of medical writing during my day job as well. So there's kind of two components to that. I honestly, if I think all the way back, I've wanted to be a writer since I was in second grade. I've always loved to write. I've always enjoyed it. I've always enjoyed reading. Everything is like narrative writing. We get into pharmacy school, all of a sudden it switches to scientific writing, and you're like, oh my gosh. I just did some really cool stuff where I'm writing acting scripts too, which can be part of medical writing, which is you're writing as though you speak instead of writing how you read. So there's so many facets to it. And so with that, as a pharmacist, I was like, hey, I can do continuing education. I can do different things. And I didn't really get myself off the ground until about a year ago. And so I've always really wanted to do this. And as I said, during my day job, I obviously write a lot, articles, different things like that. So it's really an all encompassing. And since I like it, I was like, why not do it more on the side?
Gotcha. And I guess when you were going through pharmacy school and stuff, did you think about doing medical writing even back then? Were you I want to get into this, or did you not know really
when I was a student, I didn't even know you could be a teacher. I thought you had to get special training and do different things. So all of my professors had this, special whatever, but that wasn't true. And so I learned that, and that was really great. And then I don't think I honestly knew about medical writing until maybe 2 or 3 years ago. I didn't know it was a thing that pharmacists could do. So I'm really glad that we're doing this to really get that out there so that everyone else can have this opportunity.
Yeah, no, I agree. I feel like it's definitely a thing people, once they hear about it and learn more, they're like, oh, that sounds really cool. Like I might actually want to do that. So I guess you already enjoyed you're in your current role, but you already enjoy that and you got a little taste for medical writing. And you kind of already gave few examples in terms of acting, medical writing, continuing education. I'm really curious, like what type of medical writing did you have in mind when you even realized that you could do medical writing? Did you have an idea of what type?
Yeah, so I kind of broke into it doing needs assessments for grants for mostly CE companies, industry. As a faculty, we write grants, but they're not really for like continuing education. So they're more for like research. So I was like, hey, I can do it for research. Why not do it for continuing education? And so I started doing that. A lot of what else I do is doing continuing education actual programs, which is more so related to, obviously infectious disease, but they're obviously out there for every single type of pharmacy you could think of. And then I also do I write test questions. So there's a lot of other just little niches. And so this might be the next question, but I'm happy to kind of talk about basically the last year and kind of how things came full circle.
Yeah, please go right ahead. Yes, absolutely.
I don't want to skip ahead, but I feel like I'm not giving information because I'm waiting for a question and it's like,
no, we can dive right into that.
And
then and then we can go through. Yep. Sounds great.
So about a year ago, basically in last spring, during COVID, it's like, hey, I need something to do. And so I took a class, medical writing mastery. And part of doing that was you got this coaching session, like a one, check us out coaching session. And so I did the class and I did the coaching thing, talked with Alex. Alex matched me up with a coach who is in academia, so perfect for me. And so we talked through a lot of things, what I wanted to do with my role at the college, but also how I wanted to grow my side hustle. And so, I was really encouraged to reach out for different, contract employment, different contacts, to do the LinkedIn blog that I mentioned before. And it really just opened up a lot more for me to have all these opportunities with the CE presentations and the needs assessments and just a lot of different types of medical writing. So for me, and then also during my day job, I'm helping a lot of our faculty members with their writing. And then I also try to help students because I'm sitting here, I love writing, I do it all the time. And I know a lot of people might be thinking, gosh, I'm not the best writer. And you don't have to be an amazing writer to start. I think it's important to know what you need to strengthen to get there and to realize that a lot of scientific writing is cookie cutter. And it's not like narrative writing. There is some creativity to it, but it's something where you just have to get into it and just keep getting stronger and stronger. And I have learned so much about myself as a writer, what my strengths are, what my weaknesses are. Part of the coaching, you don't need a certificate to do this, but I decided to do the one through University of Chicago. And I really just I was nerding out so badly. There was a class just on tables and figures. And I was so excited that I took this opportunity. And so there is training out there if it's something that you want to break into. And a lot of, people that are in the classes with me, they were people that were, doctors all the way down to someone that was not even in the medical field and they just wanted to do it. So there's a lot of different things out there that you can do to just get started. And I'm just so happy that I went through that whole journey. And about the beginning of July, I was like, man, I can't believe that was a year ago that I did this. And it was such a good investment for me. And I'm so excited as to where I am right now.
So, well, actually someone already kind of jumped on it, but Rosie was asking, do you have a link for it? So we can try to see, we don't have to do that right now.
If you just Google it too, you can, it's the first link that pops up. It's a really wonderful program. I'm not endorsing them or anything. I'm not getting any, there's no contract there. I'm waiting on my last grade in my last class. So hopefully, that'll come through and everything is good and I can actually get my, certificate. And there's a lot of different programs out there too. So definitely check them all out to see which one fits you best.
Very cool. And I think you mentioned as well that it isn't really required, but after doing it, did you feel like it made it easier to find connections or in terms of work in medical writing, or is it more just kind of to strengthen your own, goals and everything like that, and just feeling more comfortable doing it, or a little bit of
Yeah, so
everything?
I think that for me, because of the background I had, I really went into it and I tried to keep such an open mind because I was like, I want to learn. I don't want to go into this. I know this, I know that. I just really tried to open up my mind, and that was super helpful because I feel like I learned a lot more than I would have just trying to like get through a class to get a grade. It's like, let me look at this and try to like struggle through it. And I probably asked more questions than anybody else because I was like, I want to learn. And so it's definitely not required. I think that you can um, you can network a lot, especially on LinkedIn. There's a ton of freelance opportunities. There's a ton of opportunities that are full time as well. So I think that like I get contacted like, oh hey, can you write this blog? Can you work on this for me? I have people contact me through Facebook to be like, oh yeah, like I'm at this company now and saw this on LinkedIn. And I don't know why they didn't connect me on LinkedIn, but so it's really interesting how people will find you and, you know, just do some of your own content creation, write a couple articles, even if you're not getting paid, get your name out there, get the links in your LinkedIn. And it's just kind of a big network from there. So I think that's kind of how you just have to, start the ball. And then eventually it just kind of goes rolling down the hill. And all of a sudden you're like, goodness, like, can I, what are my deadlines? I don't want to overcommit myself. Like, again, this is mostly a side hustle for me. So I'm trying to make sure that I'm not, overcommitting. And it took a while, but right now, like, I feel really good about where I am.
That's so cool. And I feel like you may have mentioned it, but when you started it, how did you find your initial work? Was it more freelance and just kind of writing articles and people finding you, or were you
So
finding work
I'm
differently?
lucky. I specialize like in ID and then also HIV. So it's a smaller pool of pharmacists to pull from when you're looking for somebody with expertise to do something. So I have that, that luck as well. I think when I was first starting out, the first needs assessment I ever wrote, I was just networking with someone at a meeting and they're like, oh, hey, like, yeah, no, I need people to do this. I'm like, yeah. I'll do it. Had no idea what I was doing. I like struggled through it. I got the end product and they were so happy with it. And I was like, really? I was like, okay. And I'm just like sitting there, like, yeah, just pretend like you do this every day. Like, just be cool, It's like when the cool kids come over to your lunch table and you're like, yeah, no, yeah. Like, they talk to me every day. And so it's something where that first step is so scary and you just have to put yourself out there, whether it's someone you talk to at a conference or through work or just someone you meet on LinkedIn or you find one of those freelance opportunities and just take that leap of faith. And if you fail and you fall flat on your face, well, you learn something for the next time and that's okay because there's a ton of other opportunities out there.
That's so cool. And that's what I love about it, right? You're even just bringing it up, and I want to dive into this later, but there's so many different types of medical writing. I think a
Oh
lot of
yeah.
people are stuck on like writing like scientific articles on studies and stuff, but there's so many
No.
other categories, which is so
Yeah.
cool. That's just the tip of the iceberg, right?
Yeah.
But I do want to go back really quick. So what is like your favorite thing about medical writing?
I think
That
my
might be hard
favorite
just to say one, but what are your
yeah.
favorite things about medical writing?
So as a pharmacist and as, you know, everything, you're always looking for the black and the white. You're always looking for the black and the white. And that's how we are. That's how we're wired. When you're a pharmacist, it's like, we're very strict. We're by the protocol. Like creatinine is supposed to be 1 and it's 1.01. Nope. No. Oh my gosh, we gotta, do something with the dosing. And so this really allows me to explore that gray area, and especially for more of the more narrative writing pieces like the blogs and things, it's awesome because it's like me, it's my voice being able to speak versus, again, more of that cookie cutter. And even within that, you can be a little bit creative and just make it more clear. But the writing piece, it really just allows you to express yourself. And the other thing I love about it is I learn something every single time. Like if I'm reviewing an article for somebody and it's on insulin, well, I practice an ID. I know nothing about insulin. I know how to write though. So I'm learning about insulin while I'm writing. I'm oh gosh, hey Milena, like this journal only allows 5 tables and figures and we have 6. Like, what do we do? And I'm looking at it and it's like I have to use my brain to really think about how can I condense this? It's all important information, but we have to follow guidelines. And so like looking at it and kind of everything just like comes off the page or like rearranges itself and then like goes back down. I'm like, hey, we can get this in 3 tables if we add like a couple columns here. So that's the fun, like detective part about it and the learning part about it. Cause you can edit anything. You don't have to be an expert in that area. The authors might eventually want somebody that is just to make sure, but grammar is grammar and clarity is clarity. And especially if you're not an expert and you can understand what they're saying, that's almost better. Because if I read an ID journal, I might know something and that maybe they need to expand upon because like the average reader isn't going to know. So I love that creativity and just the different parts of my brain that it uses.
I love that. That's so cool. I mean, it's like trying to solve a puzzle, basically. It sounds like a lot of times. And I guess so. I think we answered it, but Lana did ask, do you work for a certain medical writing company or no? I think you do a combination of stuff, right?
Yeah, I do a combination. I work for Banner Medical right now, and then everything else is mostly just usually one-off things. Like I said, it's a lot of it is ID related. So it's mostly like, hey, we need this for this, or we need that for that.
And I know you mentioned it as well. You don't have to be an expert technically on certain topics. Do you feel just as comfortable doing a different topic than you do doing ID, or does it vary?
I think it's different. It's different because if I say I do it like a topic on, an HIV topic, well, I already know the background and I know all of that. And that's super easy for me. And I'm already up on the literature and I can very easily write that. If I'm doing something I'm not familiar with, it's a little bit more digging. I have to know, okay, how is psoriasis staged? I don't know anything about psoriasis. How is it staged? How is it treated? What is the standard of care? What are the guidelines in that area? And but then once you get to the literature, it's like, okay, I can evaluate this literature. Like, what were the groups? What was the confounders? And so some of it is, if it's a new topic, I have to learn the background, but a lot of it is, this is just, it's distilling down the data and knowing, is this a good trial or not? The abstract doesn't match the results. So maybe I don't want to use this one as a citation.
Okay. And I guess you kind of touched on a little bit in terms of going to get your sort of certification and everything like that. And I'm sure for a lot of people who are interested in this, but it's also been a while since they've maybe written something or, analyze data or getting into all the guidelines on certain things that maybe they don't see very often. How much of a leap was that for you? Was it pretty, or for someone in general, maybe that wants to try this and get into that? Was it pretty extensive, or do you feel like it's pretty doable for anyone who wants to jump into something like that?
So I'm going to have a different jumping off point than I could talk to 10 different pharmacists. We are all going to have different jumping off points. There might be, 5 of those people might have a higher jumping off point than me, and 5 of them might have a lower jumping off point. I think the point to know is, how high are you on that cliff when you're jumping off? If you are, all the way up like Olympic diver, that's great. You're super comfortable. It's like you do this every day. Now you're just going to do it for other people, versus you're kind of down, like you like put your toe in the water and you're like, oh my gosh, that's so cold. So I think it's knowing where you are and then saying, okay, maybe I do want to take a course on grammar. I'm super interested. I'm a terrible writer. Let me take a course on grammar at least. Let me start reading. Let me reach out to a colleague and say, hey, can you read this for me? Can I read this for you? Let me start with something super small. Let me get in the newsletter at wherever I'm working now and just kind of work up those skills. And if you're somewhere in the middle and you're like, you know what, I don't think I need anything. Let me try to do a few assignments. Let me get a few freelance things, kind of see if I want to commit to doing something more. It's just knowing how high you are up on that cliff, because it could be a lot of anxiety for someone who has a good amount of experience, and someone with no experience might be like, yes, I'm going to do this. What do I need to do? And kind of just jump right into it. So it's just knowing where you are on that playing field.
Very cool. Very cool. And actually someone I'm not sure if you're aware of these ones. So they asked about AMWA Certificate program.
Yeah. So I was between that one and University of Chicago. And I think for me, I just looked at the actual content of them. And like I said, when I saw that tables and graphs course, I was like sold. So I know that sounds so silly, but I learned so much about tables and graphs. So I think you have to look at it, and maybe for you that the AMWA certificate is going to be better because it kind of speaks to more of what you need. For some people, it might be a different, and there's stuff all over the place. These are not the only two options out there. So definitely research. You know, there's free things, places. There's obviously ones that you have to pay for. There's ones it's a college, but it's non-college credit. So it just depends on, you know, obviously what your budget is and what you want to commit to doing. For me, I was doing this, you know, I didn't start until last October. So I even got into medical writing a little bit more with the side hustle, and then decided, you know what, I want to do more. I want to kind of just get some more formal, like people kind of telling me what their process is, so that then I can take what I was doing, see how I can do it better.
I love that. It's almost like getting your feet wet, seeing how it is, and then mastering your craft.
And for someone who's like, you know, I want to do something before I even try, that's great too, because then you have someone, they give you checklists, they do a lot of different things with you. But you know, when I first started the medical writing mastery, it's very, you know, very well communicated that you don't need anything, because with having the PharmB is definitely enough. But depending on your comfort level and what you want and what your goals are, you know, you can obviously, we're always learning. So it's fine to go and do some more of that education.
No, I couldn't agree more. And as you kind of led to it a little bit, that you do it part-time, as like, we start with a side hustle, now you do it pretty much part-time. How was that? So I guess if someone is interested in doing this, but wants to still do their current job full-time for now, right? How was that adjustment, you know, in terms of, you know, work-life balance and just being able to handle a part-time job or side hustle initially, along with your current role? How was that?
Sure. And I'm smiling because this is something that I talked about with my coach, because I not only wanted to, you know, do a little bit of job crafting with what I was doing at the university, but also, you know, I'm diving into this, and the best, you know, recommendation was just, how much time do you have every week to do this? And even if it's an hour, like you could find something, and maybe it's somebody who's like, you know what, I want to make a lot of extra money, you know, whatever, I want to pay off my loans. I want to do like every Saturday, I'm going to say I'm working 8 hours or whatever. So it depends on that. And then the other recommendation was, when you actually do get something, really time yourself as to how much time you're spending on it. So you could say, okay, I spent this much time, I got paid this much money, and this is like, okay, how do I feel about that? And if it's like, you know what, I probably need to cut it back by half. Okay, I need to find a different type of thing. You might decide, gosh, I don't like working outside of work at all, I'm just not going to do this. Or you might say, you know what, I'm really comfortable working a couple, like I get on the train, so I have an hour train ride there, an hour train ride home. That's 10 hours a week right there that I can, you know, commit to this, plus maybe a couple hours on the weekend or something. So it was really about tracking for me how much time I was spending. And so I think that's where I said, like with teaching and with this and that, like maybe I'm not accepting things like during my teaching quarter, or if there's like a busier time at work for you, or part of the month, like you always do inventory, and so like month end isn't good. You could just say like, this is, you know, when I'd be able to get to that deadline. If that doesn't work for you, like, unfortunately, I'll just have to pass, and things will come around that will eventually work for you. And so it is a balance, but it's also a lot of fulfillment for me. So I think that part of what I'm getting back is, like, if I was doing a hobby, or if I was doing something else, and kind of the same thing I would get from that is sort of what I would get from this. So it's like I spend a few less hours, you know, tending to all the plants that I accumulated during COVID, and a few more hours doing all the writing.
So it sounds like, correct me if I'm wrong, it sounds like does not feel like work to you at all when you do it. You sound like you're so excited when you're talking about it.
Yeah.
I think you've had a smile the whole time since you started.
I'm so passionate about it. And I feel I'm so happy to be doing this. Because, sorry, I was looking at the chat. And
I saw Laura's comment about so many plants.
Yeah, so many plants. Laura and I go way, way back. So
I started the garden this year too. So
I'm so passionate about like helping people find what they want. And even through the writing, like a lot of my colleagues, they hate getting word counts down. Like I have to go from 4,500 words to 4,000 words. And that's like the bane of their existence. And I'm like, oh, I'll do that for you. I'll do that in like 15 minutes. I was like, I got skills. I'll do that. And they're like, why do you like doing this? I was like, I don't know. I just like doing it. So I think when you find something you like, plus it takes a burden off of other people, it's really cool. Like that's why we're in healthcare, right? We want to help other people. And whether it's with a drug interaction or I can do something that they don't like to do, that I want to do, it feels like work sometimes. Don't get me wrong. Sometimes you're like, okay, I have this deadline, I have to get it fit in. Like, do I really want to work on slides again today? Not really, but you sort of learn how to do it, what your pattern is, how you kind of want to lay things out. And then eventually like you get better at it. And then it like, I honestly, it doesn't feel like work to me. It's definitely sometimes like, yeah, would I rather just like pick my feet up and relax? Sure. But I'm still excited to have the opportunity.
That's awesome. No, I think I totally understand, because especially when you say tables and graphs or shortening, I just get like nightmares from college when you like either wrote too much, or I guess I don't know which problem you'd rather have more of, too many words or not enough. And then you have to figure it out. But yeah, so I also wanted to go back a little bit. So when you made like that decision to start doing it, right, to start doing the side hustle, you mentioned coaching. So I'm just curious, like what helped you in that state of mind? Like what helped you kind of push forward to go for it? And was anything holding you back at that time?
So for a few years, I had really been trying to find opportunities for myself. And I'd get like one thing here, one thing there. And believe me, I was trying to ask, I was trying to do, network and different things. And then with this, the coaching, I was, I talked to my husband, I said, this is an investment. I feel really good about this. And he was like, well, if you feel like this is going to help you and like, just you like mentally, like to focus for the future, like absolutely. And so I was like, that's a really good way of thinking about this, is like, this is an investment in myself. And so jumping off from that, I had so many things to like talk about and to try and do. And I think just with, the recommendations and the networking that I had through the coaching, I was really able to like, find an actual like contract position. I was able to, with LinkedIn, I started doing the Blazing Bites blog. And so I think I get my name out there more, trying to do more content posting, and then people see you and they, click on your profile. And it's just a lot of management with that, like almost like you're project managing yourself. And then once you actually start getting some things, you want to do a good job because you want them to come back and say, hey, like, can you do this for me now? Can you do that? Contacting people. And I did a few things, just like I said, like to get my name out there through a few like affiliations I already had. And like I said, I do this for my day job too. So I think that also helps to kind of, get people to be like, hey, do you want to do this? Do you not want to do this? But I think that just, taking that leap of, if I could have done it myself, and I tried to do it myself and it did not work, and it wasn't for lack of trying. So I think for me, it was just that focus and the fact that I vibed so well with my coach. It just really helped to propel me. And none of that really felt like work. I watched all of Alex's videos, and I can attest that he is very good at video blogs, because that's basically what he was doing. And it really just, the whole program just helped me to kind of focus myself. And like I said, I did some, job crafting in my day job too, just with all the skills that I learned. So I think just overall, like, if we could do these things ourselves, we could. But when you can't, like, that's what the coach is there. And that's why, like, if you walked onto a soccer field, you'd have a coach there with you. You could be the best soccer player in the world. You're still going to have a coach. And that helps you to interact with everyone around you.
I love that comparison. That's awesome. And I know you kind of alluded to it, but so it sounds like you worked really hard. You said for like a year or so, you were trying to figure it out on your own. Is that correct? Or a little longer?
I would say even longer. Because like I said, I didn't know this was like a thing. And like years ago, I got contacted to do a webinar, and I was like, oh, this is cool. I want to do more of this. And then it was like, okay, they didn't take any of my other ideas, and it kind of just like fizzled out there. I reached out to one company and they didn't really have any positions. I reached out to another one. and they didn't really have anything. And so it's just kind of like, I probably should have, I mean, I can't even look back and be like, oh, I should have tried harder. I think I just have to try differently. I wasn't doing anything necessarily wrong, but it was like, I needed that person to be like, hey, like, to get across the river, like hop on that stone over there. Do you kind of see it out of your peripheral vision? And you look at it, you're like, oh yeah, how did I miss that stone? That's going to get me across so much faster.
Yeah. No, that's what I like about coaching too, is like, it's almost like someone else is thinking outside of your box, because all you pretty much see is inside your box, and someone sees over here, which isn't far away, but they're like, how about you, what about this? Any thoughts on this? And, or just having that accountability partner as well, just kind of pushing you forward, helping you out and helping you think of things that maybe didn't come up before. And it makes a huge difference. So couldn't agree more. And I did kind of want to allude a little bit more to, so I know you do it part-time. Do you know many people, or what are your thoughts on doing this full-time? If someone wants to like jump right to this, or not right to it, but make a transition into this and
absolutely.
part-time to full-time, maybe.
Highly, sorry, I didn't mean to cut you off.
No, you're fine.
I got excited. I would highly recommend joining AMWA, which is the American Medical Writers Association. They have great resources for people who do want to make that transition. And I'm not plugging them. I'm not getting any money from them. And didn't even want to make that transition, but I like signed up for the emails, and I would see people asking, how do you do this? How do you do that? I'm making the switch, and I'm sure, because you really have to say like, are you just going to like quit your day job and start writing? Are you going to like slowly transition? Are you going to try to do it for a little while? And then there are full-time positions for medical writers, and they're all over the place in terms of what the scope is. Regulatory writing is huge. So anything for the FDA, investigational review board, protocols, consent forms, huge. I also took an elective in that class too. And so there's a ton of things you can do full time, and a lot of it's remote. Some of it's not remote, depending on where you are. So I think that organization gives you really great ways of, oh gosh, I had this client and they were like the worst. Like, how do I fire them? Like, I got this person asking me to do this. It's not quite passing the sniff test. What do you guys think about it? And they have a ton of articles and just things like that. So obviously, and it depends on everyone's financial situation, right? Like maybe you can just quit your day job and try to start doing this full time. So there's a lot of resources there, but it's definitely doable. There's a lot of people that do this. And a lot of people, they, make their own hours. They do their own project management. They have their own, software to keep track of everything. And then there's people that do this for industry, for different hospitals. My regulatory writing professor, she works at University of Chicago for the hospital, and all she does is like oncology regulatory writing. So it's really, there's just a ton of it out there. And I didn't know that was a thing you could do for a job. So it was really cool.
Do you mind, I know you're kind of giving a bunch of examples there. Do you mind if we kind of like spend a little bit of time on going out on all the maybe non-traditional type of medical writings topics that are out there? I know Lily, you just brought up a bunch right there as well with regulatory, CEs, webinars, acting out med writing. Can you kind of go into a little bit of each one and your thoughts on each one?
So it's medical writing and editing is kind of what the whole thing is. So on the editing side, somebody has already written something, whether it's a scientific manuscript mostly, or just, a blog or whatever it is, you're going to be editing it. There's a couple different kinds of editing. You can be a copy editor, which is like the very nitty gritty with commas and things like that. And then there's a substantive editor, which is where you're saying, hey, this paragraph would go better at the beginning, and this should maybe move towards the end. And, this sentence is completely out of place. So there's different editing you can actually do. On the writing side, as we said, so continuing education, just webinars. Sometimes they are pre-recorded, sometimes they're live. Sometimes you might get asked to do, you kind of do the slides and then someone else is presenting. So you're kind of making up content for someone else to present. There's also with the webinars, the CEs, most of them, I keep saying webinar because like everything has been, recorded for the past year and a half. Let me see. Then there's
you mind if I pause right there really quick?
Sure.
I'm sorry. So for the webinar or CEs, so you said usually it's more you writing it for them. You're not actually presenting.
It depends. There's both. There's both. So I've done it where you're writing it for someone else, and then where I'm actually creating the content and then I'm presenting it. I'm making the questions. Sometimes other people are writing the questions for you, but like a lot of the time I'll write the questions. So it's a hodgepodge of a lot of different things that people can do. There's podcasts. Someone might need you to write a podcast that someone else is going to present, or you could just be the one doing the podcast. It kind of depends on what area you're into.
Gotcha. Okay. All right. Thank you.
Yeah. There's test questions. So if you can write for the NAPLEX or just for different, things to do test questions for. There is, just your general, like GoodRx reached out to me. They have a blog. Sometimes people reach out to you with a topic. Sometimes they'll say, hey, you're in this area. What topics do you think are good to write about? And sometimes they're super short. I mean, okay, for me, 1,000 words is like super short. That might be super long for somebody, but 1,000 words is not a lot of words. And then let me see. There are, let's see what else I've done. There's also, if you are writing and you're doing any type of editing for like scientific articles, the certificates go, and you should always look up like authorships. Like if you're editing something, it doesn't necessarily make you an author, but if you want to write something with someone and like have it published in a journal, as long as you meet like authorship criteria, like you should be an author on it. Those aren't, obviously paid positions, but sometimes that helps just to get your name out there too, if you have something appropriate for publication. A lot of ICHP has their own news journal, IPHA, like a lot of the states, I'm sure other states as well have things that you can do like that. Again, just to get your name out there, do something. I've written for Pharmacy Times, just and get my name out there. And it's all like, they approve the topic. It's not like I just, kind of threw something at them. So there is some back work to that, but, there's a lot of hot topics in pharmacy right now.
I think Laura just mentioned too, write for your state association to get your foot in the door.
Oh, yeah. So I'm the assistant editor for the ICHP Keep Posted News Journal. So that I get to edit all the time with that. I'm on a couple editorial boards too, like again, for my day job, like service for, the university, outside service. So I get a lot of editing just that way too. And we love it when people submit and it's like their first time author. And I always tell them, like, reach out, like I will help you figure out, like that's another one of my skills. Like if you tell me 5 things you're doing, I will come up with something for you to write about. Like it's just kind of how my brain works.
Do you find it, that brings up a great point as well. Maybe someone who's like, well, I don't even know what I would want to write about, right? Like there's so many options out here. Like, what do you recommend to someone who's just like, maybe they're overwhelmed now. They're like, wow, I was like so stuck on just being scientific writing and stuff. Like now I have all these options. I don't even know where to start.
So reach out to whatever you want to do. So say I'll pick on Wyoming. Say you're a pharmacist in Wyoming and you're like, gosh, I want to write. So, and you're a member of the state society, like reach out to them and say, hey, I'm really interested in being an author. Do you have any topics that you want right now? Do you have any advice for me? Like, what are you looking for? And they might be like, oh yeah, can you write about this? Can you write about that? Or what do you do? Or like, so if someone did that in Illinois, they'd get funneled to me and like, I would talk to them and be like, well, what have you done recently? What are you interested in? It's the same thing I ask my students when they're doing for Blazing Bites. I'm like, what are you interested in? It doesn't have to be ID. What do you want to do? I've had students that write about microaggressions. I've had students that do sports medicine. I've had students that did an update to the STI guidelines because they're super interested in the ER. And there's obviously a lot of treatment of those in the ER. So it's, what do you like? And then you have to find a platform for it. And sometimes that initial conversation is really helpful because you're not starting and then coming to them with something and maybe they don't need it. You go to them and you say, hey, like, what kind of content are you looking for? What can I add? And they might say, oh, you work in ambulatory care, you do diabetes care. Like, can you comment on the cost of insulin? Can you write a commentary on that? So sometimes reaching out and having that help for topics is helpful. I almost like it when someone reaches out to me and they're like, hey, can you write this? Here's the title and the objectives. And I can be like, I know exactly what you want. Like, yes or no, I can or can't do that. So if you're reaching out to them and saying, can you like help me come up with that title and objectives for whatever or an outline, if it's just a short blog or something, then when you start, you know what they want and you're a little bit better set up, because that part is hard. I always say sometimes I would rather edit than start with a blank page. Like that blank Word document, when you look at it, it is so intimidating. But if I have somebody send me something, it could be the worst thing I've ever read, but I still like that better because now I can edit it. I have a purpose. I know exactly what to do. So it's trying to find those stepping stones to get you to where you want. So don't feel as though you have to leap across the ravine. Again, you have to find those stepping stones along the way.
No, I love that. I think that's a great point, to reach out to people and find out what exactly are you looking for? How can I help?
Yeah.
Or how can I help with that? What's your objective overall? I think that is a very intimidating part, to try and come up with a title and then a blank page and try to write the whole thing, especially if you're starting out. But it almost brings up a good point, or a really good question based on your point there. Do you think it might be easier for someone who's kind of just stepping into this to get their feet wet, maybe to try editing first, something that's already kind of written, to just get an idea of like what it should look like overall, and kind of, or does it not really matter?
It depends on what you want to do. If you want to be an editor, absolutely. To me, that's the easier thing to do than to write. Some people might have no interest in editing and still the writing they want to write, but that blank page scares them. And I think that's where reaching out, working with somebody else, maybe, again, if you're going to do like an article for the state association, work with a buddy, kind of just write something and take that small step and then say, okay, I'm going to do, 3 kind of articles like this, get an idea of the writing process, get back into it. And if I'm happy there, then I'm going to start like trying to get some freelance stuff. And then I can point to these things that I've written and kind of show them. So that's the hard part, is like starting out and setting yourself up for success. Is, sometimes the first things you're doing, you're not going to get paid for them if you want to do this as a side hustle, but it's like an investment, and you shouldn't write 10 articles for free. Like, do 1 or 2 and then say like, I have to focus on something else. But that really helps to get that foundation there, and also to give yourself a little confidence boost that, hey, I wrote something, people are reading it, they're clicking on it. I can pick an interesting topic, and you just kind of keep building your resume from there. But starting small is absolutely fine.
That brings up a great point as we're kind of getting towards the end of today. But I wanted to bring up, like, so if someone wants to jump in and I really want to write, but you like you said, you read my mind. I was going to ask about doing it for free in the beginning. So possibly like just getting your feet wet, maybe doing an article or 2, just to kind of get noticed. When someone wants to do that, maybe, hey, like, I'm really passionate about, you recommended like sports medicine or something like that, right? If they wanted to write an article on sports medicine, let's say, and they post it on their LinkedIn, what is like the best way for them to gain traction that you've seen for someone to maybe get noticed, so then they can start writing for others?
So, and I think this can be for any social media, right? Infographics are awesome. Or if you have a visual pictograph you could do of your article to post that. People love pictures. Tag somebody. If you did it in, or like for ICHP, Illinois, ICHP, Illinois Council of Health Systems Pharmacists, tag, like, say, I am, very proud of this new article and keep posted from ICHP, and like you tag ICHP. Like I always tag my students, so it gets out there. So it's not just my network, it's their network. So trying to tag people using hashtags, commenting on it, comment on other people's. I've networked with a few medical writers, and I've only ever met them on Twitter and then on LinkedIn. And one time someone like tagged me to like, hey, do you have any other suggestions? Because it was like, oh, what are the, big skills for something? And I was like, oh my gosh, this person tagged me. Like that was like the coolest thing that like had ever happened to me. So it's just keeping up with the content, doing different things, you know, all the tags, just anything you would really do on social media, on Twitter, to try and get yourself out there more.
I love that. That's so cool. That's really, and especially like it just makes you realize how small like the pharmacy world or just the world is, that like, that you can connect and find people and they find you, and it's just
scary.
It's very cool. But yes.
Yeah.
And I do want to quickly, you know, I know we went to it in the beginning, but I wanted to bring it up again for anyone who maybe just jumped in or just kind of reiterate it. But since you started and jumped into medical writing as a side hustle and part-time and still doing it, how overall, when you reflect back to when you started it and where you are now, like when you just reflect on it, how does it make you feel now to have discovered medical writing, to be doing it and doing such a variety of topics, and it's not just one thing, right? Overall, like how would you explain that?
So I have learned a lot about myself and what my skills are. And so I feel like everything I've learned just on the job, like medical writing training, you know, through the certificate as well, everything translates. So it's like, okay, what I was doing in my day job translates to this because, you know, I know how to look at articles. I know how to do this. I know how to assess literature. But then how I'm learning how to be more efficient with my writing, that helps me when I'm, you know, doing anything at work. And I've learned so much about clarity and content. Like I look at my exam questions and I'm like, oh gosh, I can write this better. I need to fix this. And anyone else might look at that and be like, no, that's a good question. But I can look at it and say, I can make this shorter. I can make it more clear. So I think everything translates back and forth. And that to me is pretty cool too, because obviously we write emails every day. Like there's just a ton of writing that you already do. And I think it just helps you look at everything a different way. And then you just have to be careful because you look at other people's writing and you have to be very careful and nice if you're like trying to correct something. One of the biggest things I learned was that if you are going to correct, it should be for a grammatical reason or like some kind of reason other than just your own style, because everybody does have their own style of writing. So depending on like, you know, if I'm an author on something, I might go through because my name's on it. So I'm going to, you know, buzz through it a little bit more and make it more in my tone versus if I'm editing, just straight editing someone else's, you know, paper on insulin. I'm not an author. They're just going to acknowledge me in the acknowledgements, you know, section. I have to make sure that their voice and their tone are the ones that come through and not mine. But if something's unclear, I'm obviously going to let them know. So I think the biggest thing is just more people skills. Like it's, you know, managing all of that, managing the emails, managing deadlines, calendars, making sure my husband knows like, hey, this weekend, like I have to do this, so I can't do that. So there's a lot of just growth and fun involved.
Yeah, I like how you're saying you have to kind of look at it like more of a objective or subjective lens, depending on the topic, which is very cool. And I guess that also brings up a question. So I know you can really do as much or as little as you want, right? Do you feel like that you can kind of do this at your own time or own pace, and it doesn't seem like it takes up too much time for you overall? Or did it take you a while to kind of get to that, find your groove per se, where it didn't feel like it was as much time consuming?
So I think the big piece of this is deadlines and when is something due. So if somebody came to me today, you know, it's July 26th and they're like, oh, I need something by August 1st. And I'd have to look at that and say, like, if I was just starting out, I would say, no, I don't know myself and how long it might take me to do something. Now, if somebody says, hey, can I get like a 250 word blurb from you by August 1st? Sorry about the short notice, blah, blah, blah. I'd be like, oh yeah, I can do 250 words, no problem. Or if they say, you know, I need a full 60 slide PowerPoint by August 1st, like, no, thank you. So I think at first you really have to make sure you're allowing yourself enough time to figure out how long something is going to take you. And so I went through that, and then you kind of learn, plus you get more efficient too. So you kind of learn like, okay, if I have to write this needs assessment, I need to dedicate 5 or 6 hours for that. And I'm going to break that up in 2-hour chunks. And I kind of have my outline of how I'm going to do like the literature and then the writing. And then I'm going to go through and do, you know, the polishing. If I'm going to do a slide set, it's kind of like another process that I go through. So I think until you really know how long things will take you, it's always good to do things with longer deadlines, which isn't always the case. So sometimes you might have to say, I'm going to do this now. I'm going to, the next 2 weeks, this is what I'm going to do because I want to learn. I want to know what I'm going to do, knowing that in the future, maybe I'm not going to be able to do that, but I'm just trying to learn. So some of it is knowing you are putting a little bit more stress on yourself because maybe you don't want to have to do it every day, but you're going to do it at first just to learn it, to get that under your belt, and then say, hey, can you, write me a review or recommend me on LinkedIn, or can I use you as a reference? And then you can go from there and then say, okay, I'm only taking things where the deadline is 4 weeks out or more, just based on my lifestyle. So maybe at first you might have to do something just to kind of get a few under your belt, and then you can start kind of saying no to things. And kind of picking and choosing what you want. But of course, you should never start with something if it's not going to work out for you. Like if you can't do it, you don't want to do it and then, miss the deadline. But if you're saying to yourself, I'm going to do this for a couple months just to get some experience, and then I'm going to kind of space it out a little bit more so that I have more me time.
No, I love that, especially where you're saying like that's putting that work-life balance, into action, right?
Yeah.
I love that, especially saying, okay, out 4 weeks, and so then you're not stressed about it. You're not trying to cram to get it done or anything like that. I love that. And I was going to ask this earlier, and well, Smokey wrote to everyone. Do you do ghostwriting for other professionals?
So no, it really, and this is definitely, I'm very thankful for learning this. Like, and I kind of knew authorship criteria from my fellowship and from being in academia, but if I'm writing, like I have not yet written an article like start to finish for somebody, or written a book or whatever somebody wanted, like just start to finish. But you should always be acknowledged somewhere, whether it's your name or if you work for a company, the company's name. It should always be somewhere that that's what happened. And it doesn't take away from anything. It's just acknowledging that you had help, and that's so important in the scientific world. And then the other way is true too. Like I'm not going to add myself on. Like I looked at a manuscript for a colleague, and they're like, oh yeah, we'll put you on as an author. I was like, no. All I did was move around some paragraphs. Like I do not meet authorship criteria. I send them what I want them to put in the acknowledgements. Something about like thoughtful review of the manuscript or something like that, or because especially if I'm not getting paid to do it and it's like part of work. So I think that it's so important, and there's ethics courses that I took, but I wouldn't ever like write something and then let someone else kind of put their name on it.
That makes perfect sense. And the questions are coming in. So,
oh, great.
Ahmed asked, what are your thoughts on working as a medical writer in healthcare marketing agency? Pros and cons.
So, anytime industry is involved, right? People like they worry about, oh gosh, like if I'm going to be involved in industry, how am I going to be perceived? And I think that your reputation precedes you. So if you are a good person and you have, good ethics and high morals, and people just know that about you, it's not going to matter where you work. They're going to know like, oh, this person is ethical. And I think on the other side of that, if you have a passion for this and you want to work for marketing, well, hey, you can make sure all the information is correct. That you're going to be only doing good information. You don't want things spun a certain way that it's inappropriate. And so that can be where you actually help the situation by trying to remove any, inappropriate language where you're, talking about. And this is one of the other things I learned in the certificate was you can manipulate numbers and statistics to sound any which way you want. You can make a 1% absolute decrease in risk sound like a 33% risk, a relative reduction. And 33% reduction sounds a whole lot better than a 1% absolute difference. So you can really be a change agent in that. So I think it's internal. And if you hold yourself to whatever, it'll be fine. I just realized the other side of that question might have just been not about that and not about industry, but that's kind of what I hear about a lot. So I think that any type of way that you're writing, especially if it's marketing and it's getting to patients, that's wonderful. Like if you do patient information, patient content, things that are geared towards patients, as a healthcare professional, you have a lot more expertise than you realize to do that, to make sure that, again, those patients are getting the correct message at the end of the day.
Awesome. You know, I love these answers. I love how everyone's really jumping in with questions. I did want to go back to one statement because you brought it up earlier as well. Needy brought up how he or she wrote an article and how they love the impact that it made with connections in terms of through future articles that they can write. And it looks like just connections overall. But I think you can attest to that as well, that it's really helps a lot. People tagging you or finding you from your work. And it sounds like if you wanted to reflect on it now since you started, I'm sure your connections have grown exponentially in your career and professionally. And is that correct, would you say?
Yeah. And I think that, you know, it's hard to network and it's easy to network at the same time. And it's almost like you talk about active and passive networking. And you really have to kind of do both. Like you have to comment on other people's stuff. You have to seek people out, but then you also have to actively, like, you know, do something, write something, tag somebody. I was doing a presentation on, and I won't get specific because I don't want to out the person. I was doing a presentation, a medical writing presentation on a specific topic. And I noticed that a lot of the literature was from one person. And so I went on LinkedIn and connected with that person. And then I, you know, posted one of their articles or a link to it saying how profound I thought it was. It was about, you know, a certain aspect of the topic. And I tagged her in it. And so, you know, she liked it or something. And then and I did the same thing on Twitter. She actually followed me on Twitter. So I was like super excited that I had made that connection with someone just through something that they wrote that I liked. So, you know, you don't have to necessarily write something to start, you know, posting something and tagging somebody and really growing that connections.
Very cool. And I think, hold on one second, Ahmad, this will probably be our last question. I'll let Alex wrap up here. What salary considerations should be kept in mind, considering that clinical pharmacy likely has a higher salary range?
That's a really great question. And I can't speak too much to the salary because I'm doing it, you know, part-time, mostly on a contract basis. I do know that depending on the company, you might just get paid a salary and they'll say, this is what you have to do, or it might be contract, like you get paid per project. So I think, you know, it's always important to look at that starting out. What are the actual salaries? Are you going to be doing it on a contract basis and really have to manage your network and your clients? Or do you want just a full-time job and someone's going to kind of tell you what you should be doing? Or, you know, what you're, you know, every week you have to do X number of things. So there's a wide range of what you can do there, but definitely, you know, thinking about considerations in terms of if you do have a specific salary now and you need to maintain that versus if you were willing to, you know, take a pay cut. For all I know, you could make more money. I haven't, you know, wanted to do that. So I think the salary is definitely something where, you know, you have to look at that and take that into consideration with this too.
100%. Yeah. And it also, just to add to that, it could definitely vary if you're looking for part-time, full-time, if you want to keep your current role, but maybe drop your hours a little bit, you know, down to maybe not full-time and do kind of both, or depending on what you're looking for, work-life balance and everything overall. Mm-hmm. So, but Milena, thank you so much for joining us today. So much knowledge, so much great answers. I'm glad we got to answer most people's, if not all of their questions. I'll let Alex jump in for a second, but thank you so much again for joining us.
Oh, thank you for having me. This was so much fun. Thanks for everyone for all the comments and the lively chat.
Milena, one final question. If you could start this all over again, this journey that you went on, would you have done anything differently?
I would have done it sooner. I wish I would have done this, you know, a couple of years ago. But also at the same time, I wouldn't have been where I was just as a person in my career. So I feel like maybe the timing did work out for the best. I think the only thing I would do is just I would have believed in myself more. And I think that's another aspect of why the coaching helped me so much, is that, I just kept making excuses, and I was just shown how that wasn't an excuse and that I shouldn't use that as an excuse. So I think for me, it's more, again, that personal growth. So everybody wants that to happen sooner, but again, maybe the timing just worked out the way that it should.
That's not a bad problem, right? Not a bad problem at all. Thank you again, Milena. I really appreciate it. Thank you for everyone again for your questions. I wanted to ask this in the beginning, but who here has actually written something or published something? Or are you thinking about doing something like that? I'd love to hear. Especially after that talk. Hopefully you were inspired. Awesome. Seeing quite a few hands here. Thinking about starting a blog. Yep. Okay. So I'll just throw this out here. This is the part of the conversation where I talk about coaching, but I don't know why I didn't consider this before. But if you are considering writing and you want it published on a website that at least has somewhat of a good Google reputation, we'd be more than happy to consider it if it fits well within our brand guidelines. Feel free to reach out or submit to us. You can find it at thehappypharmd.com. And at the top, there's a blog and it's submit something. We're more than happy to consider topics as well. If you want to consider, if you're like, I'd like to write something about this. So more than happy to consider that. So, after this webinar tonight, you're going to maybe just chill out for the next hour, maybe think about what you heard tonight. But what I'm hoping for is that your story becomes like Milena's, that you take some action, whether it is, wanting to work with someone like a coach, or whether it is jumping in, getting dirty, and finding out what it's like to be a writer. In fact, one of the companies I started back in 2014 was content writing and distribution. And we had ghostwriters, and it was a lot of fun, and I wasn't very good at it. But that's what you learn when you get your hands dirty and messy, particularly through building side hustles. But if you're interested in doing medical writing, whether on the side or starting a new career, what I would encourage you to do is to fast track the process. And it's what our coaches do for pharmacists. We help you figure out where to specialize in pharmacy, what exactly you want to write about, and how to approach whether you're wanting to build a side income or make a career transition. So Milena is one of our successful clients that got into medical writing and is doing a great job on the side. But we have a few pharmacists like Rosanna that have transitioned into it full-time. Janan Sarwar, who's one of our Happy PharmD coaches, actually just told me Friday we had a meeting because she's helping me with my book. Actually, big announcement. She is our chief content officer. We can officially announce that. She quit her day job to help us out. And she told me about a speaking or a writing gig where she's getting paid over $400 to write recipes. So medical writing, yes, is one aspect, but freelance writing, you can write about anything and everything. And it's all about following what we like to call our indispensable career model, where all you do is show up, show what the things that you're great at, and opportunities get presented to you. Milena shared a lot of stories tonight about her just showing up, doing what she's doing, liking it, loving it, and opportunities through social media, through people presenting opportunities to her, get presented to her. And we'd love to help you if you're wanting to fast track your journey. So if you're interested in something like that, or you just want to have a conversation to figure out, how does coaching fit into it? How does it fast track my process? We'd be loving to chat with you. The best place to start is to go to thehappypharmd.com/MW1. And MW1, it just stands for medical writing. And we'd love to chat with you. We'd love to find out what exactly is going on in your journey and how can we fast track that process? What can we do to take you where you are? And if it's about making more money, I know Ahmed asked that question about, but medical writers, they don't make as much. That actually is true. Average medical writers do not make as much as pharmacists. But something that actually I'd be willing to give away for free if you haven't talked with us already, or if you fill out that survey, is our negotiation book. That book is responsible for tens of thousands of dollars in additional income for pharmacists. And sometimes it comes down to negotiating what you want. So if it's about maintaining your living standards, it comes down to negotiating, proving your value, and making that happen. Again, more than willing to give that away to you guys. So if you go to thehappypharmd.com/MW1, we'd love to ask you a few questions so that we can have a really productive conversation. And one of our career advisors is going to reach out to you and schedule time to chat, figure out, is career writing, is that the right path for you, and plotting out what those first steps are. But again, I just want to hit home actually on something that I just want to leave everyone with this encouragement. More education is great, and it certainly can help you with learning the basics. But I want to empower everyone here. You don't need a residency to do this. I have written things. I have been paid to speak for CEs. And I can tell you that my residency didn't prepare me one bit for real life, but also in medical writing. You don't need that. You have a doctorate. And if you have just a BS Pharm, you have doctorate level experience. You are a professional and people respect that experience. You're capable of writing things that can lead to opportunities. And something that we've actually been developing on the back end, Milena, remind me to follow up with you if you're interested in this. You may have already taken us up on this, but I haven't talked to you specifically. But people who join us and join our program, we pair them up with 2 CE providers that pay them very, very well for the content that they make. So one of the things that I like guaranteeing in our program is that, hey, you're going to make your money back if you work with us and invest with us. It's not official yet. We're not ready to announce it, but we have quite a few clients that have started that process already. So whether you're working with us now or maybe you're considering working with us, don't be afraid to reach out to me, alex@thehappypharmd.com. And I'm more than happy to set up that conversation as well. Sam, we're all clinical pharmacists. Absolutely. I was going to swear, but this is going to be recorded and I'm meant to be a business. So you have the capability of doing this. And I just want to encourage you, whether you work with us or not, you can become a medical writer. You can be paid to write and create content. And it doesn't even have to be medical content. Just want to leave you with that tonight. If you have any questions, now's the time to ask it. I'm going to hit the end recording button and hope to hear from you guys very soon. Thanks again. And thank you, Chris and Milena.
Absolutely.